most rewarding thing about working with residents is just seeing the growth over the 7 years. It's a tremendous difference between graduating chief resident and their capabilities, their confidence, their leadership potential. Really the whole world's ahead of them and they really can do anything when they're finished.
The thing that unites Cincinnati residents or in our training is one is you really have a strong sense of ownership or responsibility over the patients and the team. Really, I think, especially here at Cincinnati, other subspecialties or other services kind of know that they can always call the general surgery residents and they'll find someone who's reliable or able to help and willing to help.
One thing that really shocked me about coming to residency here is how much of a voice the residents have in the training program and in the department, and maybe more important, how involved our faculty are in making our educational quality the strongest it can be.
Resident feedback here is incredibly important. I guess if we let you make all the decisions, that we wouldn't be a very good education program. But we really take to heart the feedback, particularly from the chief residents. We treat the chief residents here as our partners. And because we are so good at training residents, and this is a resident-centric program, that the voice of the residency here is very, very powerful.
The major academic center does big cases, complex cases, and those are done by the senior residents. We don't have many fellows here. We don't have an MIS fellowship, a colorectal fellowship, surgical oncology fellowship. So you're not competing with those fellows to do the major cases.
So our residents in Cincinnati have the opportunity to rotate through a very diverse array of rotations.
Residents rotate through Children's Hospital, which is right next door, and an outstanding facility. They rotate just down the hill from us at the Veterans Administration Hospital. And then we have residents go to 2 community hospitals in the city. One is part of our UC Health system. The other is a separate community hospital. So the combination of all those experiences give our residents a very broad exposure to how medicine is practiced.
One of the things we do is a leadership conference in Jackson Hole where we've got different faculty from our institution and outside institutions as well. And it's a meeting where we talk about development in leadership skills, development in personal skills, and development in finance, and some of the things that you don't really get out of surgical residency training as you go along.
Well, I can still tell jokes and stories about where I started when I came in. I don't think I had, certainly the medical knowledge or the technical skill that I wish I did on my first day, and I don't think anyone does. But the growth that you get in your first 2 years from help from senior residents as well as from faculty really have changed, I think, where I am today from where I was.
It really is a place, especially if you're a self-directed learner or active learner, that you can really thrive. Because the faculty and attendings really love to see residents who are hungry to learn or hungry to operate and kind of have a little bit of a go-getter attitude to really show how much they love surgery and how passionate they are about it.